So here is your new Rhythm scenar, the best treatment device for pain in the world. So you've got pain in the shoulder.
Yes.
So can you put your finger on the pain?
Yes.
That's it. So the patient can show you where the pain is. This is really important. And then you ask, on a scale from 0 to 10, how painful is it there as you stand there, where 10 is screaming point and 0 is nothing.
3.
3.
3, yeah.
Okay. And does moving it make it better or worse? Does any movement? Worse. So if you lift your arms up, does it make it worse?
No.
Or out to the side?
No.
To the back?
No.
Nope. But hunching your shoulders makes it worse, does it?
Yes, slightly.
Right. Okay. So we'll ask our patients to sit in a comfortable position to give treatment. Okay, so we've got the patient sitting comfortably in a nice warm room. So Sheila, could you point with one finger to where the pain is, please? Okay. And then what we do, we need to sort of press in to make sure we're on the most painful spot. Is that painful there?
That's really sore, yeah.
Yes. Okay. And then, so we don't lose the place, it's a good idea to draw in a circle there. Okay. So what we do first of all, switch the device on and pop it, place it on the skin away from the area that we're treating, perhaps on the opposite side, and then we turn up the power until the patient feels the sensation. Can you feel that there yet, Sheila?
Not really. Yes, now I can feel it.
So it should be slightly stronger than the pain in intensity. Is that slightly stronger than the pain?
Yes.
Good. And then what we do is use the electrode and working downwards. So we're just massaging over that point of pain. So it might feel sticky and the area might begin to look a bit red. And then we can work from left to right, then right to left, and then from down to up. So we use the 4 directions. Down, turning the device this way round, left to right, then right to left, and then from down to up. So you're massaging and you're clearing away sort of areas which feel sticky, which is where you've got blocked energy. That's it. So that's a lot less sticky. The device is moving smoothly over the area. So that's the first part of the treatment. So the second part of the treatment, we use AM. So remember, we cycle through until we get AM and press the up button immediately. And you can see the central light, it's on for 3 seconds and off for 1. So you're in amplitude modulation there. And what we do, we place the device exactly on that point of pain. And just check with the patient to make sure the power level's right. Is the intensity slightly stronger than the pain?
Yes, it is.
Good. And then you can treat for 5 minutes. So the device will automatically switch off after 5 minutes, or you can time it on a clock. So after 5 minutes, take the device off, and then we check and see what the result is. So how much pain have you got there now when you're just sitting there without moving it?
It's gone down to about a 2.
Right, so, and you can really feel the difference between before we started and after the treatment, down to a 2.
Yes, definite difference.
Yeah, so you need to get the patient to acknowledge that difference, because then the brain acknowledges it. So next, if you like to move your shoulder and see how that feels when you move your shoulder now. Because hunching the shoulder made it feel worse,
Yes,
didn't it?
that feels better.
Yeah.
Yeah.
But there's still some residual pain there.
Yes.
Okay, so what we need to do is treat the residual pain now using frequency modulation. So what we do first of all, we can turn the amplitude modulation off. So just cycling through. There's the amplitude modulation. Press minus immediately. Didn't quite do that. Then we turn frequency modulation on. So cycling through, and as soon as you get to FM, press the plus button. I pressed AM. Let's cycle through, switch AM off, cycle through, and press FM. So we're in frequency modulation, and if I turn the power up, you can see that that central light is sort of slowly dimming and flickering, and then the frequency is going up, and it's on more constantly. That's a higher frequency. Okay, so we just turn it down again before we treat the patient. So what we do, we replace the device on the skin and turn it up again so that the intensity is slightly stronger than the pain. So just let me know when, please.
Yeah, that's good. That's very good.
And then what we do is treat for 2 minutes. Then after 2 minutes we take the device off, and then we can work.
Turn that down.
Yes, the patient may ask you to turn it down, and that's completely okay. So we just pop it on the skin, turn it down. Is that more comfortable for you?
Yes.
Good. So you can hear the frequency changing. So again, you're working north to south, west to east, east to west. And south to north. So if you work on there for 2 minutes, and then after 2 minutes, replace the device and treat using frequency modulation for 2 minutes. So after 2 minutes treatment, take the device off and then ask the patient to test out the shoulder now. So how does that feel now, Sheila?
That feels better. Just a little bit left, tiny little bit of pain left.
Okay.
Most of it has gone now.
Right,
Most of
okay.
it's all gone.
Okay, so just like to sit round.
Okay.
So what we do next, we put the device back on. We're still in frequency modulation, remember? And is the intensity the right level still?
Yes, it is.
Yeah. And then whilst we're treating, we get the patient to move the painful area. So if you like to move it whilst we're actually treating. So you just like to tense and relax the shoulder slowly. So tensing, hold and relax. Tensing, hold and relax. Tensing, hold and relax. And then you ask the patient, can you still feel the pain whilst we're actually treating there? If you like to move your shoulder, can you still feel the pain there?
No.
Okay, then we pop the device off and get the patient to move the shoulder.
No pain. There's no pain.
So the pain's gone down to 0.